This is episode 6 of Two Holistic Psychiatrists Talking. And today we thought we would talk about mold toxicity. And because it's such an enormous topic and such an important topic for both of us in terms of the patients that we see in our practice, we decided that we would break this topic down into 3 parts. Today we're going to talk about what is mold toxicity and what are some of the common psychiatric symptoms associated with it. So why on earth is a psychiatrist talking about mold toxicity? And what are some of the physical symptoms that we see related to mold toxicity? And our next episode will be about how do we evaluate a person for mold toxicity and how do we evaluate the home. And the third part will be evaluation, will be treatment of mold toxicity. And then we hope to host a live episode where we will recap what we've talked about and listeners can ask questions. So, Courtney, do you want to say something about why we're even talking about this topic to begin with?
So it turns out in what we do, and we should say people are contacting us because they have brain-related symptoms. But what we find is that there's a lot of those individuals have mold toxicity as a primary root cause of their symptoms, be it depression, anxiety, attention problems, fatigue. And we've both had mold toxicity ourselves, so that's what took us into this area. And with that, we've also trained with who I think we would both consider one of the pioneers and experts in the world in this area, who is Dr. Neil Nathan. He's the integrative and functional medicine physician who really specializes in treating patients with complicated chronic illness, and is he's the doctor that doctors go to get help for complicated patients, and he's been our mentor. Dr. Richie Shoemaker was the physician who is really the original pioneer who brought it to everyone's attention, anyone who was paying attention, in 2005 with his book Mold Warriors. And then Dr. Joseph Brewer, who's an infectious disease doctor in Kansas, University of Kansas, and then Neil Nathan, they've sort of expanded his work, but also taken it in a different direction. So we can talk more about that later.
And it's made a big difference for both of us in terms of our own health, and makes a big difference in our practices when we identify it with our patients and treat it. So it's probably one of the most important aspects of my practice at this point.
Mm-hmm. And really satisfying to see people who've struggled and seen many doctors and specialists, and it turns out they had mold toxicity.
Right, and it's not a diagnosis that is recognized by conventional medicine as positive, and because it's not recognized, it can't be treated. And so very often these are patients who have seen multiple doctors besides psychiatrists, because mold toxicity is a condition that can affect every organ system of the body.
We should point out what it's not, that this is not mold allergy. So we consider, when it comes to mold, we consider, yes, someone can have an environmental allergy to mold, and that's not necessarily what we're talking about.
Right.
But we're talking about toxicity, so mold toxins getting into the body. And then thirdly can be mold colonization, where the mold is actually colonized the body, either in the sinuses or the gastrointestinal tract, and further contributing to toxicity.
Right. But what is toxicity? Like, why does a person become toxic? Like,
right.
What happens? Like, how does a person get it?
So that can be basically being in a water damaged space. So anywhere where water is retained in a building, so that could be an office building, a home, a dorm,
School,
a nursery, a school,
bathroom.
Right. And there doesn't have to be evidence that there's been water damage. There doesn't have to be stains on the ceiling or a leaky roof. Although
And
there's plenty of that.
so, right, when they're exposed to these water damaged buildings, which is increasingly common also because of like the building materials that are used
Mhm.
these days. Many buildings are made of drywall, which is kind of like paper, and it's like a perfect mold medium.
And in fact, there actually is stachybotrys. There's two molds that are actually in drywall. I mean, they've studied it and they're in the drywall. And so when the drywall gets wet, then, things can take off from there. So they used to say it was 50% of buildings. And yes, with the changes in building, and also buildings now being so contained, there's not room to breathe.
Right. There's like these like there's a it's a good thing that there's an attention to trying to make buildings energy efficient and green, but then what happens is that the air is all trapped inside and the buildings don't breathe. And if there is any kind of water damage and there is any mold growing in the walls, that it just concentrates in the room because there's no airflow with the
Right.
exchange with the outside.
And we could probably comment too on, with the different patients that we've worked with, where their exposures have been from. And I mean, certainly basements are common, and
Breathing systems.
they're right, ductwork, and even crawl spaces people
Yep.
might not think about, and that the mold can literally make its way to a second or floor from a crawl space. It's
Right.
not, you don't have to be in that space to be exposed. And dorms are common. I see a lot of and hear of a lot of situations where people go off to college and deteriorate.
Right. And another thing is like hotel rooms. Like some of these hotel rooms have carpeting, often have carpeting, and there'll be mold in the hotel room. Like um, since I've been kind of sensitized and my awareness increased about my own response to mold toxins, I can tell if I go into a hotel room and the room is moldy, and it can cause a whole variety of symptoms. And so when you travel, you need to be very aware that the um, space that you're going to be staying in, it doesn't have mold.
Right. And especially if you're one of those people who we think is about 25% of people who can't mount an immune response. The toxins are um, ingested, inhaled, or making their way into the skin. So really able to travel throughout the body,
Mhm.
and that they go from the tissues in the body to the liver, gallbladder, and they can go into the GI tract, but they get reabsorbed with the bile salts. So they don't necessarily go anywhere other than just keep circulating throughout the body unless some specific interventions are implemented to bind them, which we'll talk about in a future
Episode.
episode.
Yeah. So Courtney, when somebody calls you on the phone and you're evaluating um, them to begin with, like what tips you off in the direction that mold toxicity may be an issue for them?
Well, and I should say, really at this point, it's in the back of my mind for everybody because it just seems to be so common. But if somebody has, if someone has had a high sensitivity to a lot of medications and seeming even supplements, and they seem to just be highly reactive or having symptoms of mast cell activation, which we'll talk about, sort of being reactive to almost everything,
Yeah.
or randomly, and having random psychiatric and physical symptoms.
Yeah.
Um, and then if something in their timeline jumps out, which certainly when I meet with them, we do a deep timeline. But if when they initially call, they've had a recent move or they've just started, their symptoms correlate with going off to college and living in a dorm,
Yeah.
things like that.
Mm-hmm. Yeah, I would agree with everything you said. And, like specifically for me, like when there's a lot of other involvement of other organ systems besides just their brain, it makes me start to think that there's something going on in terms of mold toxicity.
Right. Even how many specialists they've seen before they call. I mean, that's the red flag right there. If
Right.
they've seen the neurologist and the cardiologist and
The eye doctor. In
yeah,
terms of the brain, like we can see just about every kind of psychiatric symptom, right?
right.
So what are some of them that are just super common?
So, anxiety, depression, uh, cognitive issues, attention problems. One thing that's always been striking to me is OCD in terms of people that it's almost like their brain knows something's wrong and it's looking for a place to put that fear,
Yeah.
but the something that's wrong is the toxin that's present, and so their contamination fears might be around germs and hand washing. In the meantime, they have, mold in their house, and they're doing all these rituals. And so I've seen that a number of times, and it's just so interesting to me how, like, their limbic system knows there's a danger. It just
Right,
doesn't,
right,
hasn't landed on it.
right. I think anxiety is probably one of the most common ones, and panic and also sleep disturbance is super common.
Mm-hmm. Right. And a vigilance, and for some people, even a paranoia can be present,
Yeah.
or even difficulty just engaging with people. I mean, I've met a number of people who, they could talk one on one, and it starts to be like viral symptoms, where
Social
being in
anxiety.
crowds or having to navigate social situations just becomes exhausting or not satisfying at all.
Yeah.
And then reading, which isn't necessarily a psychiatric issue, but being able to remember what one has read. So a lot of people that were readers find that they can't enjoy reading anymore.
Right. Memory problems, cognitive problems.
Right. So, um, and and the way that it can cause some of the other things that we've talked about in previous episodes, to me always feels like the root of the root of the root.
Yes. Yes. Right. And until you get to the root of the root of the root, then you're just treating something that is not getting to the heart of it. Well, I mean, we could like start at the top of the head, and we've talked a lot about the different brain symptoms, but if you just kind of go down, like there's a lot of sinus symptoms, right? Like people who have chronic sinusitis and who have
Right.
like surgeries, like tonsil stuff. Um,
And with the head, we should even think too about neurologic symptoms. So headaches, blurred vision, um, neurodegenerative diagnoses like atypical Parkinson's or even ALS or dementia.
right. Alzheimer's. And then people who have just weird neurological symptoms like weird numbnesses and tinglings and patterns of symptoms that don't really follow like classic neurological uh,
Right.
diagnoses. And therefore, many of these patients will be thought to be having a conversion disorder, which is another way of saying that it's all in their head. Uh,
Mm-hmm.
and that is sort of reinforced by the fact that they've seen so many specialists and are running from this doctor to that because they have symptoms affecting every organ system.
Right. Right. It's very demoralizing.
Yeah, and invalidating.
Mm-hmm.
So,
And balance would be another neurologic symptom
right,
that's somewhat of a red flag.
it's really common.
I'm sorry. I mean,
Ringing in the ears, tinnitus.
oh, yes. Mm-hmm. It's trouble swallowing as we move down. That can be a symptom.
Right, and all kinds of breathing symptoms, right? Asthma
Shortness of breath. Mm-hmm.
and the heart. People can have palpitations.
Right.
Uh,
Some
GI,
people have chest pain or abdominal pain.
yeah, food intolerances,
Right. And
constipation.
Right, the whole range of gastrointestinal symptoms.
Right. Um,
And we should mention here too that rapid and progressive weight gain.
Absolutely. Obesity is really common with it.
Right.
People who can't lose weight,
Mm-hmm.
metabolism just seems deranged.
Right. Or people who, they moved, they just can't pin down why, but then all of a sudden they started to gain weight. I mean, that for
Yeah.
some people is the
Right.
main symptom that they're struggling with,
Right.
not knowing it's mold toxicity.
Right. And then a lot of people have symptoms related to their hormones, like they have really bad premenstrual syndrome or like really very difficult menopause
Right.
or big reactions to birth control pills.
Mm-hmm. And frequent urination, and with that, excessive thirst.
Right. Interstitial cystitis is a common diagnosis that is related to mold toxicity.
Right. And so that can be the experience of feeling like you're having a bladder infection when there's not an obvious infection. It's more of a inflammatory response
Right. Right.
that can be pretty painful. Um, and too, we should mention, was there any other, we talked about, I guess joint pain could be.
And just systemic things like fatigue, like terrible fatigue, and exercise, lack of exercise tolerance.
Right, and temperature dysregulation, so feeling cold when it's warm, or
Right.
a high appetite or appetite swings.
Yeah. And even things, this is again like more of a brain psychiatric thing, but dissociation and depersonalization, just like,
Or derealization too, like feeling things aren't real or like you're outside yourself.
yeah.
Hmm. Yeah.
No, it really, I think in part that's why people who don't recognize, doctors who don't recognize that this is all caused by mold toxicity, think that it's impossible that a person could have symptoms related to so many different organ systems. And when they do the conventional testing that they do, they don't see it because they're not testing for the right things.
Right.
I mean, there's like a whole list of diagnoses that be related to exposure to environmental toxins and mold toxins in particular. And we mentioned Alzheimer's and other dementias and epilepsy and seizure disorders. We mentioned POTS, Parkinson's disease, autistic spectrum disorders, uh, all the psychiatric conditions that we mentioned, autoimmune diseases, even cancer, diabetes and metabolic syndrome and obesity, cardiovascular disease, food sensitivities, including celiac, leaky gut, asthma and allergies, pneumonia and chronic obstructive pulmonary disease, and psoriasis and eczema. All of those can be mold-related conditions.
We should mention, which is so common, chronic fatigue syndrome,
Fibromyalgia.
and fibromyalgia.
Right, these chronic mysterious illnesses that are so difficult for conventional medicine to have any impact with.
Right. And Dr. Brewer, who we mentioned in the beginning, he did a study in 2013, and it was I want to say it was like 113 patients with chronic fatigue syndrome, and I believe it was 93% had toxic levels of mold.
Wow, I didn't know that.
And they might have had other factors obviously contributing too, but it's big when it comes to chronic fatigue. And I speak to that personally because when I had mold toxicity, though I had some low grade neurologic symptoms, fatigue and brain fog were my primary symptoms. And obviously somebody doesn't have to have all their systems affected. I mean, we'll see children with ADHD, like that's their
right.
that's their symptoms, inattention, impulsivity, hyperactivity, but what they have is mold toxicity, and they may not have any other symptoms.
Right. And I think part of why Courtney and I are so interested in this is because it's made such a difference for each of us in terms of our own health, treating it, and also for our patients. So it's just really can be a game changer to identify it and treat it.
So that's what we'll talk about next time. How to identify it and then how to treat it.
Yeah. All right. Good.